歡迎大家嚟到。
Welcome to the press briefing. We have Dr. Chong Suk Kwan, Head Communicable Disease Branch Center for Health Protection, and Dr. Lau Kai Hin, Chief Manager, Hospital Authority. Dr. Chuang will give you an update on the cases. Good afternoon. Last night, we have 116 confirmed cases, case number 14333 to 14448. There are 13 cases that are imported. 103 are local cases. Among the 103 local cases, 17 carry the L452R variant strain, and we suspect that to be Delta. And then there are 71 cases suspected to be Omicron. 15 cases are still pending the DNA analysis. For the 103 locally infected cases, 73 are linked to other cases. For 30 cases, they are not traceable at the moment. As for vertical transmission in some buildings, Kwai Fong House, Kwai Fong Estate, Unit 06, there are 2 levels of units with transmission. And then our colleagues, the relevant colleagues, went to check the drainage system, and they didn't find any problem. But it's possible that it's because the ventilation fan or exhaust fan is switched on, and so that draws air from one unit to another. So we are evacuating residents of Unit 606 on the 24th and 25th floor. As for Tai Hing Estate, our colleagues are now checking the resident units at Heng Chun House, and then in Tai Po, there are 2 also units with cases. They are on top of one another. And then for units in 13 to 18th floor, the residents need to be evacuated. And then in other linked cases, there are at least 2 who've been to Ap Street, Sham Shui Po, street number 97 to 191. On the first floor, Unit B, there is temple. I don't know how to pronounce the name of the temple, but then there were about 10 or 20 people there praying and doing worshipping rituals. But then they didn't eat, or then they didn't take off the mask, but then there could be transmission there. So we appeal to someone who've been to that temple on the 28th of January. They will have to take compulsory tests. And then Hong Kong Sports Institute in Sha Tin, there are 2 confirmed cases. And there's 1 preliminary positive case too. For the 2 confirmed cases, the patients, they not just stay at one place, they actually moved about. So that's why for anyone who's been to the Hong Kong Sports Institute, they would have to take the compulsory test. And as for 30 cases, we couldn't trace the source of infection yet. And but these cases are spread all over the territory. And on the Hong Kong side, Cornhill Block 5, Yi Fong Court, Sai Ying Pun, and then Mong Kok, Cheung Sha Wan, and then Chi Ching Estate, Ching On House, Wong Tai Sin, Hui Sum House, To Kwa Wan Making, and then Lam Tin Kai Yen House, Sek Yam Estate, and then Choi Wan Estate, Ming Lai House, and then Chiang Kwan O Hong Sing, Phase 1B, and then Po Ning House, and then Chak Chang House, Tin Chak Estate, Fuk Shui House, Yuen Long Estate, Tin Mun Butterfly Estate, Tip Ming House, Chin Wan Shek Kuk House, Shang Chui Yuen Shui Ho Court, and then Sha Tin Pai Tau Village, Sha Tin Tau New Village, and then Cam Yu Court, Ma Shan, Tai Wo, Fuk Wo, Lai Wo Houses, and and Serenity Villa, Block 10, and then Fenling Carfolk House. And then there are 2 who carry the reconnaissance papers. We're still checking the cases. Now we're seeing more and more untraceable cases. And we find that when these cases found, they would have already spread to others, especially family members. So the cases are spreading quickly, and it seems the incubation period is relatively short. That is, the date of onset of the patient with that of family members is close to each other, maybe just after a day or so. So therefore, the situation is really serious now. And so we have to appeal to everyone to work together with us. You really have to pay attention to environmental hygiene. So that's all from me. Dr. Lau, please, for the hospital authority. Well, this is the 2nd day of the Chinese New Year. I wish you all good health and prosperity. Now, as at 9 a.m. today, in the past 24 hours, our system reported 155 reportable cases. And then in the last 24 hours, another 20 patients have recovered and were discharged. So far, 12,826 patients have recovered and been discharged. And then there are 1,220 patients in the North Lantau Hospital Infection Control Center, the HA Infectious Disease Center, and then the AWE hospital, as well as 13 public hospitals. They're staying at these different places, and there is 1 patient in critical condition. That's case number 13400. For other patients, they're in stable condition. For the case number 13400, who's in critical condition, the patient is now in Queen Mary's Hospital. It's a 77-year-old female. Now she has chronic diseases, including diabetes. She was admitted on the 24th of January. Then his condition deteriorated. Last night, she was transferred to the intensive care unit. She's now in a critical condition. The health care workers will watch her case closely. Now, the patient has not been vaccinated according to records. So here we would like to appeal to the public again to get vaccinated as soon as possible, because then that will help to reduce the chances of serious complications or death risk if they infected with COVID. And that's another case of a patient at the general outpatient clinic. A patient went to Shun Tech General Fraternity Association General Outpatient Clinic on the 31st of January, and then the patient eventually contracted COVID. Now, on the 31st of January, the patient went to see a doctor because of a sore throat, and then yesterday, on the 2nd of or the 1st of February, deep throat saliva sample was submitted, and then the sample tested positive. Now, at the clinic, there were transparent petitions to segregate doctors and patients. Now, during the consultation, the doctor checked the throat of the patient, but no other high-risk procedures were carried out. Now, the patient at the time, the doctor at the time, did not wear a suitable eye protection gear. So to play safe, the doctor is listed as a close contact and has to be quarantined. Now, while the patient was waiting for consultation, the patient was wearing masks all the time. And then for the doctor did not carry out any clinical duties or come into contact with the patients after the 31st of January. For the outpatient clinic, there was a thorough disinfection carried out. And I'd like to also make an announcement on patient arrangement. The hospital authority in the Hong Kong U conducted a study before. Now, if a patient has a CD value of over 30, it's no longer possible to do a culture of the virus. As you know, we have seen a surge of COVID patients in the past weeks. In the past 7 days, on average, 120 patients need to be admitted, and also the length of stay has extended to 17 days on average, especially for the elderly. We find that most of them stay close to 20 days in hospital. And our experts have reviewed the study findings. We agree to update our discharge guidelines. And we have informed the Center for Health Protection. We have received the agreement of the Department of Health to make this contingency arrangement, or to make this special arrangement. Now, one of the criteria is that if there are 2 negative samples within 24 hours, or there are 3 samples with a CD value of over 33, or if the antibody test changed from positive to negative, and there's 1 sample test with a CD value of over 33. And then the stay must be over 10 days from the date of onset, and then that the patient would meet the criteria for discharge. And then for those patients who meet the discharge criteria, they must still undergo 14 days of home quarantine and health surveillance, and they have to be tested periodically. Now, we believe there will be relatively more patients who would meet the discharge criteria, but then we need to put in place the reference procedures, such as providing the electronic wristband and other arrangements. So we need time to make the preparation, and we ask patients for their understanding, and we will try to arrange for patients to go home for isolation as soon as possible. That is, patients who meet the criteria. Thank you.
Questions? The lady on the right, far right. I'm from cable TV. A question for the HA. It was mentioned for those with a CT value of over 33, then the patients can be discharged. How safe is it? And what will be the discharge arrangements? Can the patient just leave on his own, or would there be an ambulance to take him home for home isolation? Some experts are saying that for a CT value of over 30, then is no longer able to culture the virus. Then why would a 14-day of isolation required? And how many patients to expect that you can be discharged because of this new discharge criteria? Now, we have been carrying out studies with the University of Hong Kong. We sent them virus or samples for cultures. Now, for samples with a CT value of over 30, it is no longer possible to have the virus cultured. That means the virus is all dead. So we have set it at a CT value of 33. So for samples with CT value of over 33, the possibility of is they're containing the virus is very low, and it would be safe for the patients to be discharged. The possibility of transmission to another person is very low. Now, this is a requirement by the Department of Health. After discharge, a patient has to be under home isolation for 14 days and be subject to health surveillance, including being tested on a regular basis. Next question. The reporter next to the previous one. I'm from Commercial Radio. With this new discharge criteria, to what extent can the length of hospitalization be shortened? Will that increase the turnover of patients? Will you regard these patients as fully recovered patients, just like recovered flu patients? What will be the discharge arrangements? For instance, will they have to be subject to testing, and for how many times, if so? Given that Omicron is particularly infectious, Now, if a patient can be subject to home isolation, what will be the risk to family members living together? And some buildings had a vertical transmission and also had sewage samples that were tested positive. What special arrangements will you put in place for these patients? We test patients on a daily basis to check the CT value and to see whether they are free of the virus. It's difficult for us to anticipate whether the CT value will be above or below 33. Now, for today and tomorrow, there will be about 50 to 60 patients eligible for discharge. In the past 24 hours, only 20 or so patients were discharged. We are going to amend the discharge criteria that are safe, and then more patients can be discharged. Of course, that doesn't mean that everyone can be discharged. First, the patient has to be free of symptoms, no longer with fever. In fact, some patients here are either asymptomatic or with very mild symptoms. So we follow scientific evidence. We have tests, and for CT value of over 30, no live culture can be done, and so a CT value of 33 is very safe, and it's not likely that the patient can be infectious. And then after discharge, the patient has to be in home isolation for 14 days and be tested regularly. We do not make a distinction between whether it is an Omicron or Delta case. When a patient is discharged, whether he has Omicron or Delta, the new criteria still apply. The lady in the front, the gentleman in the front, I'm from Now TV. We're told that there's now a critical patient. Can you tell us what chronic disease she's suffering? And has she got any medical certificate for exemption from vaccination? I'd like to know whether she is the first critical patient in this wave of outbreak. And for there are about 30 cases untraceable yet. Would you say that the situation is now out of control? This morning in Taiwo, there were 3 cases, and then a Meishan building, which is not far away, have to have residents evacuated. Would you say that you have to be more vigilant about the situation in Taipo? There may be a few transmission chains. And then for the discharge criteria, according to patients, now if they are treated at AWE, they have to provide deep throat saliva samples, and if the CT value is over 33, then they can be discharged. Are you worried that patients may not give you deep throat saliva samples? They may use their own means to achieve an early discharge, even though they are not yet ready. So will you have different ways to test these patients to ensure that they are safe for discharge? Regarding case number 13400, the elderly lady who is in critical condition, she has high lipos, blood lipos, and also diabetes. These are very common chronic diseases. When doctors are explaining to patients, chronic patients, that if their conditions are safe, are stable, and there is no adjustment in medication, then they are fit to receive the vaccine. In fact, everyone in Hong Kong should be vaccinated against COVID-19. This is particularly so for the elderly, like this lady. She is over 70, and for chronic patients, so long as their conditions are stable, then they can receive the jab. And then the chance of a complication and death will be much lowered after vaccination. So we appeal to everyone in Hong Kong to be vaccinated as soon as possible. And as for the discharge criteria, I appreciate the community's concerns. In fact, for the pre-discharge testing, prior to discharge, the samples will be taken by medical staff instead of the patient himself. So if for 3 samples in a row with 24 hours apart, the CT value is over 33, then it's pretty safe for the patient to be discharged.
Are we seeing an increase in the number of cases and also in the number of untraceable cases? So we haven't yet reached the peak. That's why we must all be very careful and we must watch the situation closely. For Tai Wu Gardens, well, there's actually the same family involving the confirmed cases today. Sorry, speaker is not using microphone. As far as I could recall, yes. Next question, please. On the front, the lady there.
From our THK. The first is, do you expect the number of unlinked cases to climb further? And does short incubation period of cases bring difficulties in tracing cases? And for the relaxation of discharge criteria, how many cases could still infect others when the COVID CT value is over 33 before? And also, if family members of the patients discharged could still go out, then why still home quarantine the patients? Thank you.
Judging from the number of cases, especially those without traceable sources, the increasing trend, so we expect the number of cases without sources is expected to be increasing. And because of the short incubation period, once he or she is diagnosed, he or she may have already infected other people in the family or in the workplace or in other close contacts. So the speed of spread is very quick, and it's very difficult to contain all these cases, including their close contacts, to trace them and put them under quarantine. Yeah.
After relaxing the discharge criteria, we will expect there will be more patients can be discharged. However, at this moment, I can't predict who will become negative or will have CT value less than 33 in the coming days. But for the coming 1 to 2 days, we will expect there will be, for example, today or tomorrow, we will expect there will be 50, 60 patients who can be discharged according to the new criteria. And you can see there will be increased number of cases that can be discharged. According to what I announced today, there will be only 20 in the past 24 hours. So there, according to the old discharge criteria. So we expect that the number of patients that can be discharged will be increased. We have been having a research with University of Hong Kong that the growth or the culture of the virus of the sample whose CT value of more than 30 will be there with no virus growth. That means the virus has died. Only that virus can be found, will be predicted from this culture when the samples CT value is more than 30. So we will expect the patient will be safe when at home when the patient is discharged according to the new criteria.
I omitted to mention that so far we have 110 preliminary positive cases. Sorry, the speaker is not using the microphone.
There's the criteria from Department of Health, which is important for making sure that the patient is safe in the community, and also observing the health status and repeat the test after being discharged from the hospital.
One more English question. The lady on the front row, please.
Thank you. A question from SCMP. So with another record-breaking and traceable case in the fifth wave and a large number of places involved, is the situation getting out of control? What else can be done to contain it? And as like you guys have already trained 10,000 people to join the tracking team, will the capacity be enlarged? And second, how many residents or flats in each building which have suspected vertical transmission need to be evacuated? And third, how early can we see the new discharge arrangements to be implemented? Would the same arrangement apply to imported case? And is there a risk of spreading the virus to their home members? And how many tests does the patient need to undergo during the 14 days period? Will they be tested at home, or do they need to go to the testing center? And do they need to wear a wristband to track the location? Thank you.
Because of the high infectivity of the Omicron and also the short incubation period, the number of unlinked cases is getting increasing, and the situation is getting worse. So we have already redeployed a lot of disciplinary force members to our contact tracing office. So currently we have around 500 officers in the 2 centers. So if necessary, we may further increase the number of people doing the tracing job. And I can't, for those buildings we have evacuation, we'll list out those number of flats in our later on the press release later on. Yeah.
The effective date of the new criteria for the discharge is from today. That means the patient can be discharged according to the new criteria today. When the patient's CT values is more than 33, the virus is already there. We can't go for any virus from the sample whose CT value is more than 30 in the study in the University of Hong Kong. So that means the patient is not infective, and it's safe for the patient to stay at home, and the family will not be affected when the patient is discharged.
Next question. So
Need to wear the wrist. Sorry?
Sorry, speaker's not using a microphone. Sorry, I'm not sure because it's for the Department of Health to arrange the discharge arrangement. I'm not sure about the testing requirements yet. The one in the white shirt, please. I'm from TVB. For the 17 suspected Delta cases, are they concentrated in a particular district? Are we seeing further cases in Kowloon East? So it's not just Omicron then. Even for Delta cases that's getting out of control, is it the case? And then we are seeing an increase in the number of untraceable cases in the past 2 days. So does it mean there are many more silent transmission chains? In that case, how would the Center for Health Protection adjust your tracing work? And third question now, do you think you'll be exceeding your testing capacity or quarantine capacity soon? Well, for quarantine facilities, we're increasing those facilities because we know there will be an increase in the number of close contacts. That's why we are looking for new quarantine facilities. For the 17 Delta cases, they are linked to previous cases, most of them, that is. But of course, there are a few cases that that we could not trace the origin. For example, Chek-Sing House, Tin Shui Wai, and then Butterfly Estate, Tip Ling House. That's one case that's untraceable, and then also Festival City in Taiwan, phase 3. Now, these are untraceable cases, so we are seeing signs of the cases in other districts.
Speaker is not speaking into a microphone. Tracing is one way to contain the pandemic, but it's just to a certain extent. Because we have to know where the case has been to, where he lives, and with whom. And of course, we have to expedite our tracing work because we have got more manpower to do it. But still, we need the cooperation of the public. By the time these cases have been to different places, we have to trace people have been to there and have them quarantined, and we will lag behind the transmission. So it's the best is that they haven't been to many places, and that's the best way to contain the situation. This reporter on the right. I'm from RTHK. I've got 2 questions. We have 30 cases that are still untraceable, and this is a recent high, and the number is rising recently. What do you expect that after the holidays there will be a geometrical explosion of these cases? Now, you have a few preliminary positive cases in Taipo. Would you expect a mini outbreak in Taipo? Well, recently, at home situations and also at workplaces, there have been small gatherings and some outbreaks after the Chinese New Year. Now, it all depends on what happens, and if there have been many gatherings, we can expect a rise in the number of cases. Omicron is very infectious, and these cases tend to rise geometrically. Recently, we're still seeing a steady increase. Perhaps that's because we have been carrying out restriction and testing operations. As regards how many cases are yet unknown, now we don't know. Because very often we have got one case known, and then as soon as the contacts are tested, then we will have a surge of cases. Yes, Hong Kong Institute of Sports is a place where there is a mini outbreak already. This lady on the left-hand side, I'm from Hong Kong 01. We've seen many untraceable cases as well as linked cases. Have they been sharing meals together? Because this is Chinese New Year time. There are many gatherings and sharing of meals. And I'd like to know how many of these cases are Omicron, how many are Delta cases. For cases that have been to a temple, did they remove their masks and also eat? I'd like to know whether the 2 cases involved went to the temple at around the same time, and will people also present need to be quarantined? A question for the HA. The elderly lady who is in critical condition, I'd like to know whether is an Omicron or Delta case, and what treatment is being provided by HA. We have 3 Delta cases yet untraceable. Of course, many of the transmissions took place at home or during gatherings when people were eating together. The 2 cases involving the temple were there around the same time, from 2 to 3 p.m. According to them, they did not remove their masks, but there are 2 cases there, and probably there were also some other people present. So there was some form of transmission. So for people who were there at around 2 to 3 p.m. on that day, they will all have to be quarantined. How many of them? A dozen or so, according to 2 cases. But we have to look into the case. There might be more. The elderly lady she has got the Delta variant. As soon as she was hospitalized, we gave her interferon and remdesivir. These are antiviral medicine. At first, she was stable, but then her condition worsened these 2 days, and she was admitted to ICU last night. Of course, she's an elderly lady with chronic diseases, so we gave her antiviral as soon as she was admitted. If she had been vaccinated, the situation might have been better because vaccination could lower the risk of complications and death. The lady there. I'm from Oriental Daily. Regarding the new discharge criteria, previously you wanted to follow the practice of the mainland, and there was adjustment of the discharge criteria, but now there is yet another round of amendment. I'd like to know the yardstick. Will you tighten the discharge criteria when we are closer to the time of reopening the borders with the mainland? And can you reiterate the arrangements for home isolation and the number of tests to be conducted, and whether the discharged patient will be allowed to go out, and will samples be taken from the patient at home? And as for vertical possible the situation at Tong Mun House, is there any possibility of vertical transmission, and what are the possible risks? As I said, we have more and more admissions. Now, in the past 7 days, on average, we have got 120 patients admitted to different facilities of the HA for isolation as well as treatment. So this is a contingency arrangement. Of course, we have to ensure that it's safe and evidence-based and supported by our studies. When the CT value is over 30, then it's unlikely to culture the virus from these samples. That means such samples are not really infectious. So if we have 3 samples, each taken 24 hours apart with a CT value of over 33, then it should be pretty safe for the patient to be discharged. As for future criteria, we keep collaborating with different organizations, including the Department of Health and the Food and Health Bureau. When necessary, the criteria can be adjusted to tie in with the government's policy. This time, we have a current contingency arrangement to make available more beds so that patients that need to be admitted can be admitted quite quickly. For discharged patients, I understand that they will have to be subject to 14 days of home isolation as required by the Department of Health, plus health surveillance. They have to wear electronic wristbands. So relevant government departments will put on the wristbands for them and explain to them things to note when under home isolation. I'm sorry, I don't know. What are the testing arrangements? Well, in Serenity Villa, that is at Block 10, we're talking about one family that has to be tested. We're not talking about a few units. Last question, the gentleman at the back. I'm from Mingpao. I'd like to ask about that temple in Sam Shui Po. Can you at least spell out the name? And can you tell us more? I'd like to know whether the 2 cases know each other and whether you have taken environmental samples. If so, what are the results? You mentioned the 2 were on Renaissance papers. Do you have any difficulty in tracing these cases? The CHPA has recently announced a number of buildings with possible vertical transmissions. Do you expect this trend to continue? And is there anything you can do to tackle this situation? In the past, there was only a case of vertical transmission after a while, but now we have got a few. So how do you assess the risk? And as for the discharge criteria, for case 13400, what is the treatment protocol for that patient? And are you worried that with a Delta outbreak, there will be more and more critical cases? The temple spells HAZRAT, and the second word is SIRKO, and the third AKBAR, Society in Hong Kong. That's a temple. Abdale Street, number 97 to 101, Chung Fuk Building, flat B, first floor in Sam Shui Po. We have to find the two cases first before we can understand their detailed situation. They went to a community testing center and with those documents, and we cannot contact them by the phone, not reachable by phone. And for vertical transmissions, there can be a few reasons. Perhaps the virus is highly transmissible through air. For two levels together, perhaps the pipes are okay, but if one has got the ventilation fan or exhaust fan on and the other floor has the windows open, then a virus can be extracted in, and sometimes there can be turbulences, and sometimes due to the U-trap drains. Buildings in Hong Kong are very dense, and that is one possibility, and this also reflects the high transmissibility and airborne nature of Omicron. The case 13400, the elderly lady, because of her condition, she has been transferred to ICU for treatment. We give her supportive treatment because her lungs and her heart are in a critical condition, so we're giving her supportive treatment. Whether we talk about Delta or Omicron, as seen overseas, senior patients with multiple chronic diseases have a higher risk of complications and death compared with younger patients with no underlying diseases. That's exactly why we hope that our senior citizens and those with chronic diseases should receive the jab as soon as possible. Because there are many transmission chains in society and the risk of infection is high. For someone who has been vaccinated, and even though he's contracted the disease, the possibility of death or complications is lower. The PB ends here. For people who were there at the same time, they have to be put under quarantine, and those are not present at the same time, they have to be tested.